Suni, Santosh's mom. Now I would like everybody to turn on these lights to celebrate the lives of the one who lost their lives to suicide.
Thank you for that.
कुछ प्राचीन बंदिशें मैं आप लोगों को सुना रहा हूं। तगनगदा नगते तागदा गदा तगनगदा तगतट तगतट कदागन नकतट नकतट ताकदागगद नरता कदा गदा तगनगदा नगते तागदा गदा तगनगदा नगते तागदा गदा तगनगदा। ये सब घिन्न की बंदिश है। घिनता था घन्न 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 दागृत दाक्रांत दाते घन्न 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 दागृत दाक्रांत दाते घन्न 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 दागृत दाक्रांत दा दागृत धन दागृत 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 घिनता था दाते घन्न 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 दागृत दाक्रांत दाते घन्न 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 दागृत दाक्रांत दाते घन्न 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 दागृत दाक्रांत दागृत धन दागृत दागृत घिनता था दाते घन्न 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 दागृत दाक्रांत दाते घन्न 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 दागृत दाक्रांत दाते घन्न 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 दागृत दाक्रांत। अब दिन की बंदिश सुनिए। धाता धाती धागे नाग दिन कद कद धा कडन कद कद गना ग्रंथ कद 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 धाता धाती धागे नाग दिन कद कद धा कडन कद कद गना ग्रंथ कद 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 धाता धाती धागे नागे दिन कद कद धा। Nagatana Dagagan and Nagatan Taran and Setanina, Kiranaka Dumikata, Takata, then cut the record, then cut the record, then cut the record. Nagatana Dagagan and Nagatan Taran and Setanina.
My name is Dr. Chandra. You may know me, and I'm currently the Indian Medical Association. And on behalf of Indian Medical Association, I would like to thank each and every one of you for coming out today and being part of IMA Asha Child Suicide and Opioid Prevention event. And Asha in Hindi means hope, and that is exactly what we hope, that this event will be a major step forward in the fight against epidemic of child suicide and opioid abuse. It opened my eyes when I found out that these two issues collectively claim the lives of almost 270 individuals each day. I don't know if you guys knew that or not. I did not. 270 people every single day. Last year in Indiana, 1,097 people died of suicide only. So you guys have to understand what the magnitude of the problem is. And we all have to do something. Our part, whichever part it is, means just asking your neighbor, as Dr. Gold said last time, just asking your neighbor, are you okay? And even maybe that sentence puts them back from the cliff where they're about to jump off. Because sometimes that's what it takes. And then everything seems okay. It may not be completely okay, but at least it is not up to the limit where we want to take our lives. So that is the only reason for this event today, is to create that awareness, because I sincerely believe, and I'm sure you guys believe too, because awareness is the one which is going to lead to action. So that is the hope and Asha from this event is. And Asha is the first event of its kind to bring such a wide array of expert resources, not just being collecting here. We will have a panel discussion afterwards, after we have these testimonies and opening remarks from the eminent players in our community, and you will have expert panels. And this panel is not accessible to anybody, believe me. During routine hours, it is not. So we rather take that opportunity and ask them these questions, what we are doing and helping out the community and how we are doing it. That does not mean that they will have all the answers, because if we had answers, then we won't have 270 people die every day. That means we have to find answers, and to find answers, we have to work in that direction. And I'm a neonatologist. That means however steps or baby steps, I will call them, they are, if they are in right direction, I can guarantee you we can make a difference. So the first term, so by bringing this panel, that's what my hope is, to get all these people sit here, which are professors, law enforcement, psychologists, psychiatrists, all wide array of people. But before the panel, we want to know what everybody feels about it, and we will have personal testimony from people who have lost their loved ones to this menace. So we have 3 people come up to the stage and talk about their personal experiences. I know it is very difficult for them to talk about it, there is no question about it, but sometimes sharing that experience can definitely save somebody's life. And that's what they are here for, and that's why they are, again, to stand up and relive that pain which nobody wants to live again. So first person to talk, I'm going to call Tony Ferrero on the board first, and everybody gets a couple of minutes to say, otherwise this will obviously can go into an extended period of time. And Tony is representing Senator Mike Brown, who is a regional director for the senator, and obviously he can introduce himself. I had written something about Mike, but I think he's a better person to tell about Mike than me getting it from the internet. Thank you so much, Mike.
Thank you, Dr. Chandra. First and foremost, obviously, my name is Tony Ferraro. I'm the Regional Director for United States Senator Mike Braun. I want to thank Dr. Chandra. I want to thank everyone for being here, especially in the inclement weather. I want to thank my friend Diren, who introduced me to the doctor and gave me the opportunity to come here and speak on the Senator's behalf. What we're doing on behalf of the Senator every day is is what we're doing in partnership here today, which is we're operating. There are 7 regional directors. We're doing this between 35 and 50 times throughout the state, and it's a direct community outreach. What we're doing is trying to make your federal representatives and what we can do for our constituents more accessible. Those are issues with Social Security, VA, immigration, and also give you a direct contact to what we're all here to talk about today, which is, the scourge that these opioids have created in our community. More importantly, what the senator has done just on Tuesday is reached across the aisle, and Senator Edward Markey from Massachusetts introduced a bipartisan bill of 2 parts: the Label Act, which is lessening it by enhancing labeling, Opioids Act, which would federally mandate that all opioids prescribed come with clear and concise labels explaining what these are and the dangers that they possess. Secondly, the second part of the legislation that he had just prescribed is the Safe Prescribing of Controlled Substances Act, which is mandating training for all medical professionals and pharmacists that are going to prescribe these drugs into our communities. So, there's one thing for us to come out here and say things and all that, politician stuff. Personally, I'm not here to do that, and I can personally tell you that the senator isn't either. We have introduced legislation this very week. We have reached out across the aisle. It is bipartisan. It is common sense, and that is what we are committed to doing for Hoosiers and Americans going forward. Thank you so much for your time, and I really appreciate it.
Community, born and raised in Crown Point, so she's our own, so she can probably feel the pain for all of us because she's right from here. She is a lawyer by profession and finished her degree from Valparaiso University. Again, right? Lisa, please.
I'd just like to thank everyone, and I really appreciate Dr. Chandra inviting me, and also my good friends Amira and AJ Muhammad for inviting me here today. I am the state rep in House District 19, which is Crown Point, half of Hobart, Winfield, and Lakes of Four Seasons, and a little bit of Porter County. So, although I wasn't on the health committee, there was a couple bills that I want to talk about because they were really important bills that I supported, and I believe they address HEA 1007 2019 is the OB Navigator and Verbal Screening Bill. It's now law. It was actually signed into law. And the purpose of this bill was to reduce infant and maternal deaths and reduce the opiate addiction. Dr. Christina Box, who's the state health commissioner, testified in favor of this box, or in favor of the law, and was really instrumental in pushing this law forward. So there's 2 parts to the law. First, it's a perinatal navigator program, which IDs high risk and matches pregnant women with wraparound services. It's a pilot project. The reason why this bill is so important is because I know a lot of you already know in the room that we're 3rd from the bottom. Indiana's 3rd from the bottom when it comes to maternal mortality, and we're 7th from the bottom when it comes to infant mortality. Since 2016 and 2017, Indiana did improve. We went from having 653 deaths, 1,000 live births in 2016 to 612 deaths in deaths out of 1,000 live births. That's not. In looking at those statistics, we also know that in white babies and Hispanic babies, that the numbers reduced significantly. But when it comes to African American babies, we're not doing well. We did not do better between 2016 and 2017. And recently, Dr. Box was in Lake County, and she was speaking about this very issue. And I will read to you what her statement was in the Northwest Indiana Times. Between 2013 and 2017, the 3 zip codes with the highest infant death rates in Indiana were all in Lake County. Gary had 20 3.1 infant deaths per 1,000 live births. Isha 8 deaths, and Hammond had 15.2 deaths. Now, part of this program is a personal one-on-one programs. There are several programs, and a lot of the programs have been run by volunteers. There was a program in St. Joe County that actually addressed the exact issue that we're talking about. How do we reduce infant mortality in African American communities? And so what that program was in St. Joe County, and it was very successful, it was to allow doulas who were volunteers to work with pregnant women. They were assigned to a pregnant woman during the pregnancy and for 1 year after the pregnancy. And the numbers were, we did really well in St. Joe County. In 33 counties out of the 92 counties in Indiana, pregnant women lack hospital or hospital services. Currently, like I said, there already are programs that are out there, and this is only expanding those programs. They're called safety pin programs. We have the doula partner, which I mentioned from St. Joe County, the Family Navigator program, which is in 37 out of the 92 counties. And in Anderson, we have the Baby and Me Too program. And what that program does, it allows to see at the same time the mother and her clinician so that they can work with the tobacco at the same time that she's actually coming in for visits. So the second part of the program the bill was requiring the State Department of Health to establish a healthcare provider to 1, use a validated and evidence-based verbal screening tool to assess a substance use disorder in pregnancy for all pregnant women who are seen by the healthcare provider. And 2, if the healthcare provider identifies a pregnant woman who has a substance use disorder and is not currently receiving treatment, they are to provide treatment or to refer the patient to treatment. We are going to be screening for alcohol, opiates, and marijuana. Of course, also tobacco. This program is about connecting treatments and resources for pregnant women. We have a drug epidemic that is affecting infant mortality rates. 44% of overdose deaths were in ages between 22 and 40, which are peak childbearing years. Pregnant women are more motivated to seek help if they're pregnant and in that first year after a child is born. So it's crucial that this program exists so that we can help pregnant women and women who have children that are home, because that's when women are more susceptible to getting the help that they need. But I have to say, the program also, in the second part of the program, where we're assessing individuals for substance use, it's not punitive in nature. And if a woman does test positive, that information is never turned over to DCS, the Department of Child Services, because we don't want women to think that they can't participate in the program because they may be turned over to DCS. And just some statistics, there were over 1,800 drug overdose deaths in Indiana in 2017. Over 1,100 of those deaths were due to opiates. 3 of every 5 Hoosiers who died from an overdose each day involved an opiate. The risk of opiate overdose has increased for both sexes, but males are at higher risk than females. Males make up 64% of all overdose deaths in 2017. Almost 30% of all opiate-involved deaths were among those between the ages of 30 and 39. That bill is so important because we really have to get to the reason why our children are number 7 in the nation when it comes to the infant mortality death. The second bill that I want to talk about is Senate Bill 359, which has also been signed into law. And this is a bill that I co-authored and I supported it. And I have to tell you that this bill was really important to me because several years ago, I'm an attorney, and several years ago there was a case involving a local community. I'm not going to say what community, but there was a young person, a student, at school who had a suicide attempt. She was unsuccessful. Then later, the child went through a program for 30 days, and at the end of the conclusion of the program was put right back in school. Soon thereafter, she had another incident. She was taken out of school with another 30-day program. And then at the conclusion of that program was put back in school, and soon thereafter, unfortunately, she was successful with her suicide, and she was a when I talked in school about this issue, it was very clear that there was a lack of communication between respect that we have for medical information or the lack of communication between the health professional, whether it's a guidance counselor, and the student. They had no idea what kind of plan was in place for the student. They couldn't help them. And it was so frustrating to the school. So let me explain a little bit about Senate Bill 359. It requires the Division of Mental Health and Addiction to establish a standard format for individualized mental health safety plans. The goal is to create a safety net for those citizens who suffer from mental illness or addiction. The bill is designed to support those with mental illness who may have been put into a crisis center. This sharing of information under this plan would help those who want to transition back into their life with those who will be willing to assess them. We can't just expect folks to go right back, or students to go right back into the school and right back into the situation and think that they're not going to continue to struggle if you don't give them the tools that they learned when they were in the treatment center. It creates a standard format mental health safety plan that can be shared with mental health providers in the community. And when we're talking about mental health providers, we're talking about the guidance counselors. We're also talking about firemen, EMTs, paramedics, who maybe go to a scene. And in the past, when we had a situation where maybe somebody was depressed, suicidal, or suffering from a substance use, it had been to maybe handcuff them and subdue them. We know now that that's not necessarily the best way to handle these cases. And we already are doing things like de-escalating the situation. But with providing this information to the paramedic and the EMT, we can save someone's life. So just to give you an idea, what is the plan? The plan is developed between mental health provider and patient and includes the patient's contact information, early warning signs, coping strategies, contact information for people the patient may ask for help, contact information for professional or agencies that can help the patient, the plan for making environmental safe for the patient, the thing that matters most for the patient and makes life worth living to the patient. Each psychiatric care center must make a good faith effort to get consent to the patient before the patient leaves the facility. But we can't wait to get the consent from the patient, especially when it's a student at the school. So this bill also provides that the plan may be disclosed to a licensed mental health professional or a licensed paramedic without a patient's consent if the person is trying to treat the patient and determines the patient may be a harm to themselves or others. I can't help but think that if we had that law several years ago, that person I was talking about, that student, would be alive today. A party that discloses the plan in good faith after these conditions are met is immune from civil and criminal liability. There was testimony from Hancock Regional Hospital when this bill was being considered. And according to the testimony, this bill considers our most precious population concerning those who are mentally ill. Children who receive social, emotional, and mental support do better in school. We know that. There are nearly 4 of 10 have seriously considered ending their life in the last 4 months. A large gap prevents us from providing care to reach these individuals. Implementing a safety plan before a student goes back into the classroom is the smartest thing that we can do. These are situations where a student returns to school without providing this knowledge to staff. It's a struggle for the school. And I will tell you there's testimony from the Indianapolis school system that we had similar situations than what we had up here, where students had been had an incident while they were on school break or for the summer break, and they came back to school and the school had no idea what plan was in place that could have saved these children's lives. So the bottom line is, some believe the schools are not the place for mental health and addiction treatment. I have the opinion that we can no longer leave this to families alone. I believe that without early intervention, a child can slip through the cracks. We have 1 of 5 people in the U.S. with a mental illness or addiction. Suicide is on a 30-year high and it's rising. More than twice as many Hoosiers die of suicide compared to homicide. After a psychiatric hold, the suicide rate goes up. For kids in Indiana between the ages of 10 and 14, suicide is the highest cause of death. It is the second leading cause of death in Indiana for 15 to 34-year-olds. What we are doing now is not working. This bill will help that, I know it will. Patients were found to be very high risk after leaving a psychiatric facility. The time after discharge is a very delicate time for individuals. Eventually you have to discharge people, but we want to ensure there's a good plan when they do leave. And I just want to say, going back to the first bill, the bill, the bill that deals with the perinatal navigator program,
HEA 1007. Most of these programs are run off of volunteers. This year we asked for $20,000 in the budget to be able to expand the doula program in South Bend that we already have had success with. And that money was, we didn't get the money in the final budget. It was pulled from the budget. And last, I would like to talk about HEA 1543, which is inpatient addiction treatment. And I've supported this bill as well, and I'll tell you why. Currently, those who are admitted to an inpatient treatment facility for addiction must be sober or in withdrawal before they can be admitted. But oftentimes, before seeking help, addicts will use drugs or consume alcohol, to get that one last high before they go in, and making them ineligible for inpatient treatment. Sometimes we know that last good high is what ends their life. This law, HEA 1543, will allow Hoosiers in need of addiction services to be admitted to an inpatient treatment facility regardless of whether or not they are sober. The law will require facilities in Indiana, like community mental health centers, to follow the American Society of Addiction Medicine's criteria when considering treatment options about whether or not to admit a person currently taking drugs or under the influence of alcohol. These are just a couple of the bills that we did this year that I think are really going to be helpful to the very nature of what we're here today, which is addiction and also suicide. And I really thank you for being here today. Thank you.
Thank you, Lisa. Thank you so much. The next speaker is Ed Charbonneau, and he's member of Indiana State Senate, and he's representing District 5, and he's Indiana State Senate Health Committee Chairman on Health and Provider Services. And above all, he was CEO and President of Methodist Hospital right here.
Thank you, Dr. Chandra. I cannot tell you how honored and humbled I am to be here today. As Dr. Chandra said, I was at one time the president and CEO of the Methodist Hospitals, and when I walked in here tonight, it was like taking a step back in time for me with all of the doctors. The first two people I think I ran into were Dr. Barai and Dr. Shah, but there were many more, so they were very helpful to me over my tenure there, always made me look better than I really am, and I thank the Lord every night when I go to bed for people that are always doing that for me. Very quickly, in the one bill I was going to talk about, Representative Beck covered in quite a bit of detail, and that's House Bill 1007, and I was the Senate sponsor of that bill with the OB navigators, and it's one of the things that Indiana is trying to do. But so often we're dealing with things after the fact. That's what makes this evening so important, and that's why when I leave here, I'm going to ask Dr. Chandra if I can have an invitation to come back next year. This is, and I will be very, very quick. There are three ways that we can deal with the beast, I'll call it, of drug addiction. Number one is prevention. Making sure that no one ever gets hooked on drugs. Number two is treatment. That's after the fact. Number three is incarceration. That's way after the fact. In number two and number three, we don't have enough doctors, we don't have enough psychologists, we don't have enough psychiatrists to treat the growing number of individuals that have these problems. If we're going to deal with it by throwing them in jail, we can put our whole budget on building new jails throughout this state. So really, there is only one long-term solution, and that is prevention. And prevention starts, and Dr. Chandra said it in his comments on the brochure here, starts with awareness. That's what you're here tonight for, and I hope that this just grows and grows and grows, because this is the kind of thing that we need if we're ever going to get out of this problem. Again, I thank you so much for allowing me to be here and say a few remarks. This is a fantastic day. I just drove back from Indianapolis to be here, and I'm glad I was able to make it. Thank you so much.
Person is our Dr. Vijay Kora, our own Dr. Vijay Kora. I don't have to introduce him because everybody knows him very well. Dr. Kora, here he is. And he has done a lot in opioid crisis to start with, and quite a bit in Michigan City. Please, Dr. Kora.
Thank you, Dr. Chandra, and thank you all for coming. You have heard about this crisis from various speakers, and they've all been eloquent. They've provided a lot of information. My perspective is from a physician who also happens to be an elected official. I'm president of the LaPorte County Commission. I've been on the county commission for 7 years now. So when the opioid crisis, it was peaking in 2011 and 2012, I was asked to serve on the National Association of Counties because I probably was the only county commissioner who was a physician. So the NACO, it's called NACO, and the National Association of Cities, we formed a joint task force to come up with some potential solutions. And we met in Cincinnati, and because Northern Kentucky was one of the epicenters of the opioid crisis. And we came up with several solutions. And one of the reasons I was interested in this was after a steady increase in our life expectancy in our country for almost a century, we have started to see that the life expectancy in our country has started to go down. And that's something that should concern all of us. And it's not going down because we are not making advances in the fight against heart disease or strokes or cancer. And the reason it's going down is because of opioid crisis and depression, suicides. So I think we as a country, we as a nation, we need to do better in terms of how we handle mental health. And I don't think we have a good infrastructure. We can do better. I know there are many mental health professionals here nodding, and I can understand what they are going through. Because even though we say that we want to get treatment, or we want to get these individuals for prompt treatment, but there is no capacity to treat them in a timely fashion. So we need to advocate for that. I think Dr. Chandra and the whole group have done a phenomenal job by raising awareness, because raising awareness is the first step in this whole issue. Now, from the medical profession's perspective, because we hear a lot about the opioid crisis is a result of prescription opioids, and that is true. But the medical profession has already taken extraordinary steps in cutting down the prescriptions of opioids. And as a matter of fact, between 2012 and 2017, the number of opioid prescriptions have gone down by about 30%. And in 2018, it went down by another 10%. Now, also we need to realize that, yes, we need to cut down the prescription of opioids, but also people who are in pain, they need to be taken care of too. So it's a balancing act, and we need to make sure that we do it in a way that we cut down the prescriptions of opioids, but also make sure that people who are in need are being taken care of. Unfortunately, after the number of prescriptions have gone down and the number of deaths from opioids have gone down, but for prescription opioids have gone down, but the number of deaths from heroin has gone up. So that's something we need to take into consideration. So anyway, as a member of this task force, what we came up with was that we need to address some of the issues that are causing these problems. Number one is to improve the capacity for mental health. And we have representatives from Senator Braun's office here, we have state representatives, state senators. We need to increase the capacity by increasing the number of residency slots, for example, for psychiatrists. It is so hard to recruit psychiatrists. And I think all of you who are here, when you communicate with your elected representatives, both state and federal, make sure that you advocate for increasing capacity for mental health professionals. Now, the bottom line is, whether it's depression or whether it is drug addiction, it's all a result of one word or one emotion, and that is despair. I think we are going through, as a nation, we are going through a phase of despair. And it peaked after the 2008 financial crisis. But financial insecurity is not the only reason that we are in this state. So it's one of the reasons, but it's also the lack of family support, social support, community support. So as a nation, as a community, we need to address the financial problems, but also we need to make sure that we have support systems right from the family through the community, and events like this will increase awareness about the importance of that. Dr. Chandra said that, just ask a neighbor how they are doing. That'll mean a lot to somebody who is in despair. So I think we need to work on that. And then lastly, I would say that we need to look at what are the antidotes for despair? How do we build hope? And I think we need to also look inside, and we can look at spirituality, and then we also, as families, we can come together, and we need to talk about it, and we need to give permission to our youngsters to talk about their issues, and that way they are comfortable talking about it, and then we need to bring whatever resources we can bring to bear to help address their problems. So thank you, Dr. Chandra, for allowing me to speak and also for organizing this event. Thank you so much.
So the next speaker is Dr. Barai, and to follow up with the change in opioid prescription and medical related things, Dr. Barai is on the licensing board for many years. So we want to have his few words. What are the changes which are upcoming in prescription of these medications, which are, again, it is a double-edged sword, whom to prescribe, whom not to prescribe, but looks like they probably are maybe the gateway drug to this addiction problem. Even though we call the other drugs the gateway drugs, maybe the marijuana and things like that. But I have heard so much of personal testimony that within 5 to 7 days of being prescribed of these medications, they were hooked onto it and they could not come off. So maybe Dr. Barai can tell us what the licensing board is trying to do to...
I'm a medical oncologist, hematologist by profession. I'm clinical assistant professor at Indiana University Medical School. But I've also had the privilege and honor of serving on the medical licensing board for the state of Indiana. I also served on the Controlled Substance Advisory Committee of the state of Indiana when it was in existence, and also as a medical liaison from the licensing board to the Attorney General. One thing I can assure you, first, I'll show you the extent of the problem in the state of Indiana and the country, and what we do on the medical licensing board to cut down unnecessary prescriptions. We recognize that there are people who legitimately need pain medications, but we also want to shut down the pain pills and unnecessary. We want to shut down unnecessary pain pills which make the people get addicted. So in 2017, almost 70,000 people died in the United States because of drug overdose. And 47,000 of them died because of opioid overdose. And if we go back to 1999, in last 18 years, almost 400,000 Americans have died because of opioid overdose. Think of it, in Vietnam War, the entire duration, about 52,000 people died, soldiers. Every year, across the country, in automobile accidents, about 40,000 people die. And we lose more people because of opioid overdose than automobile accidents. Now we have noticed 3 separate waves. In 1990s, there was an increase in the prescription of opioid overdose drugs. And in 2010, the heroin spike came. And suddenly, I'll show you the graph, how it jumped. And in 2013, the synthetic compounds, especially fentanyl that has come into the picture, along with heroin, which has been causing a lot of deaths. So you can see the graph here, the first graph in yellow, showing you heroin. The second one, which is a little bit in purple, is the commonly prescribed opioids. And the third one, which is the biggest spike, shows the synthetic opioids, the transdermal fentanyl. So these are the 3 kinds of waves we are seeing. Now you put it the other way, 130 people are dying every day from the opioid dose, which includes the prescriptions that are given by the doctors and the illicit opioid overdose. This has caused 30% increase in the visits to the emergency rooms, and this was greatest in the people above the age of 25. So what we need to do for the opioid, learn about the opioid risk, store the prescriptions for those who are getting legitimately, to store it properly so it does not go in wrong hands. Of course, naloxone saves the lives, and I believe that there was a training program for it. This is an interesting statistics. Those people who are addicted to alcohol, I'm talking addicted, not social drinkers, they are twice as more likely to get addicted to heroin. Those who are addicted to marijuana, they are 3 times more likely to get addicted to heroin, cocaine 15 times more, and opioid painkillers 40 times more. So once you get hooked up with one of them, you get hooked up with the second and third. Now let's look at the problem in the state of Indiana. There were 84 prescriptions per 100 residents in the state of Indiana, and the opioid poisoning deaths and 11.7 deaths per 100,000 population. So this is a problem. Now the state has enacted the laws for the doctors and the guidelines how they can prescribe the opioids. Believe me, in last 20 years that I've served on the Indiana State Medical Licensing Board, number 1 cause of disciplinary action against the doctors is opioid. 75% of the suspension or revocation of the license are related to opioid use, and we take it very seriously and as a very solemn duty. On one side, citizens who really need pain medications, who have chronic disease, cancer, they should be taken care of. But there should be no diversion of these drugs. They should be used only for legitimate purpose. And those doctors who do not live up to their solemn duty, we make sure that they are no longer practicing in the state of Indiana. So if you do find somebody who is illegally, unnecessarily prescribing, please fail to report it to the State Licensing Board or the Office of the Attorney General or the DEA, and we will investigate and take appropriate action. Thank you.
I gotta wait for him. Okay, there we go. Thank you. Hi, my name is Ramesh Uni. I have the pleasure of introducing our next set of speakers. We're transitioning a little bit now. You guys have heard a lot about the problems that we've had, but we now would like to share some stories from within our own community that reflect, like Dr. Cora said, despair that leads to many of these problems. So my family went through this. My brother committed suicide, and we grew up in Crown Point, part of the community, and without our community, we would not have been able to survive that probably as well as we have. And I think that there's no one better to tell our story than my youngest brother's best friend and my best friend, Tommy Listina. So I would invite him up to share our story.
Hello, and thank you for having me today. I want to thank my best friend Ramesh for giving me this opportunity. Some of the things that I want to talk to you about today, and I promise it'll be in the 5-minute range, are things I haven't really thought about in a long time, and I think it's incredibly important to think about them again. And I am happy for any opportunity I ever have to relive this experience if it helps any person that's going through struggles to choose to live as a result. So thank you for that opportunity. As I thought about what I wanted to talk about today, I asked myself, what do I think of when I think of losing my best friend Dosh? And those things that come to mind to me, and Dosh was my best friend for 15 years. When I think about losing him, I think about someone that had total comfort and total confidence, this ability to relate to everything and everyone in every situation. And I feel myself wondering when that changed. When did that detail change? When did he go from being totally comfortable to the state of discomfort and disconnect? I think about his laugh, which was this full, infectious noise that welcomed everybody and absolutely refused to stop until every single person was laughing. And I wonder, at what point in his life did he just not have the energy or whatever it is to share that laugh with us anymore? I wonder, and when I think about losing Dosh, I think about weight loss, which wasn't noticeable, or wasn't as noticeable as it should have been, because Dosh, for a long period of time, was getting into really good shape. But at some point, looking back on it, he started to look frail at some point. And I wonder, at what point did he literally choose to stop eating, or stop eating enough? And when I think about losing Dosh, I think about car accidents, a couple car accidents that happened over the years. The first one when we were about 10 years old, a very simple car accident that we were in, but I can visualize my best friend being incredibly scared and incredibly relieved that we were okay. And I wonder, as I think about that, at what point in his life did he stop being scared of death and stop being happy to be alive? I also think of another car accident. It was a one-person car accident that one of Dosh's best friends passed away in. And I can see my best friend struggling with this thought in the back of his head that maybe this one-person accident wasn't an accident at all. And this was maybe, within a year or two of Dosh committing suicide. And I just wondered, how or when did it happen where suicide just being barely a concept in his mind grew to an actual solution to his problem? I also think about, when I think about losing Dosh, I think of phone calls. I can hear the phone ring many times Whenever we had a friend that was upset or was going through a hard time, I'd get a phone call from Dosh, and he'd say, hey, this is what's going on with so-and-so. He's going through a hard time. This is what it is. We're going to get together with him tonight. He absolutely needs to have a good night. And I wonder when or if it ever happened that this person, my best friend, that always took his concerns outward. He was worried about the entire world. Was there ever a point where he thought to himself, I thought I was getting the hook. Thank you. I'm glad there was a lot of I wonder now, I'm sorry, in terms of that phone call, when did he ever just say, okay, it's time for me to stop worrying about everyone else, I really need to turn that inward and worry about myself? The last phone call that I can hear, and I could hear the phone ringing constantly, it was the morning I found out that Dosh had passed away. I was an incredibly lazy college student, asleep in my room, and the phone would not stop ringing. And as I was saying to my fellow lazy college roommate, will you please just pick up the phone and tell whoever it is to stop calling? My friend interrupted me, and in the most serious tone I've ever heard, which I can still hear right now, he said, Tommy, it's your brother. Something's happened. And I knew as soon as I took that phone, my world had changed, everything had changed from that moment forward. So I also want to kind of end in that part there, talking about the last thing I think of when I think of losing Dosh, and that is the last time I hugged him. I felt, looking back on it now, I felt almost nothing. I felt no presence. I didn't realize it at the time, but there was just nothing there. And I wonder now, what would have happened if I just never let go of that hug? So I want to push on beyond that and talk about finding Dosh as well. And I promise this will be just 2 more minutes, and then we're done. Thank you so much for listening. I really appreciate it. But in the 20 plus years since Dosh has been gone, I consider this journey that I'm on, my journey to find Dosh. And when I think about how that journey started, it started with Dosh's parents, Dr. and Mrs. Zuni, who I would go see every time I came home from college. And seemingly, or somewhere in my mind, I thought I was helping them. Truth is, they were helping me more than I can ever explain. But the key thing that just amazed me whenever I talked to them was their faith, their absolute unrelenting belief that Dosh was there with us, that his presence was there, that he was with us all, and he would always be there. And I wanted to believe that as much as I possibly could, but I just needed proof. And fittingly, I was a doubting Thomas. So I literally prayed as hard as I've ever prayed in my life, and for as long as I ever prayed in my life, that I would feel Dosh's presence again. In 8 months after that, I was awoken in the middle of the night and as scared as I've ever been because I felt that someone was in the room. I was scared for my life that someone was in the room, and I felt this person coming closer to me. And I could not see a thing, the whole experience. I never saw anything, but at the scariest moment, I felt my best friend Dosh hug me over my entire body, and it was exactly what I had been praying for, and it came at that exact moment where I needed it most, and it was exactly what I needed. Finally, the last thing I want to talk about in terms of finding Dosh The other major element, other than feeling his presence, certainly in this room, but every day of my life, I feel his presence, and I'm so confident that he is with us. The last element, one of the most, if not the most important element, is helping any other person out there in their hardest time to choose life, to choose to live. In the way that we have done that, my best friend and brother Ramesh, our other best friend and brother Suresh, and a few of our other best friends, we built the Dosh Fest community. The Dosh Fest community comes together once a year. We celebrate the life of Dosh, but we also celebrate and mourn anything that anybody within our community is feeling. So we get to our old friends together, our new friends together, all of their families, and we celebrate together, and we leave everybody with the same message every year about who we are celebrating in that time, and it's what I want to leave you with today. The Dosh Fest community, when we come together, we celebrate 3 different types of lives. We celebrate new life. So anybody in this room, anybody that has recently had a child, any baby, we celebrate that new life. We celebrate all lives lost. So whoever you are thinking about right now that you have lost, we celebrate that person with you, and we celebrate their life with you. The last person we always celebrate together, the last life we always celebrate, is your own life. If you ever feel like your life does not have value, if you ever feel like you are not loved, please realize that could not be farther from the truth. Please talk to somebody, and please know that this world will always, always, always be better with you in it. Thank you, and I love you.
Thank you so much, Tommy. He's the best speaker in our family too, so we let him do all the talking for us. But I think you can see the power of sharing experience, especially the vulnerability of sharing pain, really helps tie our community together, help us move forward as a community. And I think another person who has really turned her suffering and pain into something that brings everyone together and moves forward and brings awareness is Lisa Gold. So I would like to invite her up here to share her experience as well.
Well, Dr. Chandra, I am impressed. I'm about a 6-minute talk, I think. So, Dr. Chandra and I met, I think it was in February, at an Indian restaurant, and he had this vision for tonight. I'm amazed. I'm amazed at the collection of people, so thank you all for coming. And I could talk for half an hour about signs and people beyond sending us signs, but let me tell you, my Nolan, Dash, and Jack, they're watching us right now. And I got my Kleenex, so I'll keep it together, but it took me more than a year to be able to say the first sentence I'm going to tell you. I lost my son, Nolan. It's almost 2 years ago. He's forever 19 years old, and I lost him to suicide. Nolan was a typical teenager. He loved hanging out with his friends, and he loved doing the things that made him happy. Hanging out with friends, doing robotics, gaming, just joking around. But he was a typical teenager, and he didn't share much about how he felt with people, especially mom and dad. Nolan was one smart, great kid. He got accepted to the Purdue School of Engineering easily. But Nolan also was a very funny guy. He was a great friend. He would come up to a friend and say something goofy just to cheer them up. And he stood up to bullies. He really didn't care about himself. He cared more about his friends. What was hard, though, was that he didn't share with a lot of his friends, and he definitely didn't share with his family how he felt. It was only after his first attempt of suicide at Purdue that he shared with us that he had depression. And he said it was sometime during his junior year of high school. And I remember him telling us when we went down to Purdue in a panic when I got that phone call. Actually, he texted me. He texted me, "Mom, I need help," because his overdose didn't work and he was scared. So imagine getting that text. So as he described it, he felt like there was a slow, dark curtain that took over his life, and it made all the joy turn to gray. He couldn't experience joy, and that's called anhedonia. That's what a lot of people have when they have depression. He also slept a lot. Okay, teenagers sleep, right? He slept a lot. That's another sign for him. He also would argue. Who doesn't argue with your kid? But he really would argue, and it was always with me. I would come in and try to help him out, and he would just put up the wall, and we would fight. I didn't know this as a pediatrician, but young men, when they have depression, they have anger. However, I still approached him. I'd ask him, "Are you okay? Do you want to talk?" He would tell me no, he was fine. But then, of course, he went off to Purdue, and he walled himself off. And he couldn't handle the pain of depression, and he had his first attempt. He came back home, and he got treatment. It took time, and let me tell you, it's hard. You tell someone, just go see a therapist. We had to go through 3 or 4 of them until he finally clicked with one. We also had him take medicine. He wanted to take medicine. It was hard for him to, but he took it, and he said it helped as best as it could. But he did get better. He was home and he was working and he was with his friends. Was he perfect? No. But he was so much better. And 2 months before he took his life, he was the best we ever saw him. I remember my husband and I looking at each other and saying, "We have Nolan back. He's back." So when he decided to go to Valpo University, we thought, great, he's starting, he has hope, he has some plan. However, that knock on the door, actually it was the doorbell. September 19th, Monday night around 9:30 at night, my husband answered the door, and I walked out of the bedroom, and he was in a state of shock, but I walked and I saw right away 2 police officers, 2 people from the coroner's office with their jackets. I knew he was dead. My son was dead. And I thought to myself, he was driving, he's a drunk, he drank. He's not supposed to drink, especially with being on medicine. Oh my God, he was in a car accident. Who's in the car with him? I know my son's gone. What about his friends? And to hear them say, no, he took his life. Shock. The next day, I had to plan his funeral. Big decision. Do I keep this private? I'm a pediatrician. I didn't announce to people other than close family members and his friends he had depression. A pediatrician lost her son from depression. Do I let people know what he died from? That he died from suicide? When people die from cancer or an accident, there's certainly more sympathy for the victim and the family. Sometimes they do candlelight vigils and news articles about their passing and how great the person was. But suicide instead is greeted by whispers and questions
and speculations and whys. But I decided to not keep his funeral private. He died by suicide. He died from pain of his depression. Some of us here have lost a loved one to suicide, a family member, a friend, a coworker, a friend of a friend. Maybe you are here in support of someone who suffered from the loss. Suicide awareness has been talked more about in our society because of, again, celebrities. We've had some celebrity deaths this past year. But what happens is we talk about it a bit, some time is spent, but then it's too uncomfortable. And it's a hard thing to help. So we move on. The subject has changed. If anybody knows me, I'm a big researcher. So I've read a lot about suicide since Nolan's passing. There's an author named Thomas Joyner, and he wrote a book. He's an expert about suicide. Myths About Suicide is his book. And he states there are two psychological states of mind of a person who's considering suicide. Two things. They perceive they are a burden to others, and they have a sense of not belonging. But we know that we do not want the numbers of loss to suicide to increase. Today, we're all here today saying we want to help. We want to help those in our community who struggle with mental illness, PTSD, substance abuse, chronic pain, and other conditions known as a risk for suicide. We say we promise we will speak up if we see or hear words or actions in people we know. More than ever, we see now that asking about suicide and bringing it up is not to be feared. You're not planting a seed of idea in their head. You're asking, how are you? What is going on? We are getting better educated and more confident to act when before we might have thought we would do more harm. Finally, we are not better off without those we lost to suicide. They are never a burden to us. We acknowledge a person with suicide thoughts may feel alone, and they may feel like they do not belong. This is where we can work to give hope and opportunity for those that feel they needed to end their pain by suicide. So instead of asking why, I suggest what we need to do. We live. We live on and continue to help prevent more people ending their pain by suicide. Nolan is in my heart. He's here with me every day until I see him again. Thank you.
I don't think I can talk after that. It's really, really heartbreaking. And again, asking her to come back up and relive this is torture, in simple terms. But thank you, Dr. Gold, thank you so much. I'm going to invite Peggy Easton to share her experiences. Peggy, where are you? Okay, Peggy.
I brought a visual so that you could all see that people don't just die from drug overdoses that are bad people. We have good people, educated people, like my son, Jack. He was a 38-year-old young man who had struggled with drug addiction for a very long time. He was a prescribed medication. I'm speaking from the heart right now. My notes are out in a car with a young lady who was kind enough to take my purse today while I was helping make wrap hot dogs.
Excuse me, sir.
So I'm just going to tell you, my son was prescribed medication as a young man, and I watched him struggle, and I watched him struggle hard for over 20 years. Jack was as kind, he educated, he traveled the world, he skied Matterhorn, he did everything, but yet he couldn't kick drugs. And we waited for a call. I would lay at night, and I knew I was gonna get a call someday that my baby was gone. My son died. They found him in Gary. He died of a fentanyl overdose. It was heroin, it was sniffed, and with Jack went my heart. And he left behind a broken mom and a broken dad and a sister and brother, nieces, nephews, extended families that are forever broken. So I just want to tell people to please be aware, watch, teach your children young, talk to them. There are so many helpful brochures here. Talk to them, make them listen, and listen to them. These children have mental issues or they would not be self-medicating. The year prior to that, I lost my brother to suicide. Again, mental issues that were not addressed. So what I'm asking is for one and all to pitch in and help, volunteer, do anything you can. Talk to your children more than anything. Talk to your grandchildren, talk to your families. Living without your loved ones, they leave us broken and struggling. I'm gonna have to celebrate his birthday next week. Again, without him, this would be his second. And now, I guess I really can't say much more other than I'm praying that people just learn from this experience. And Dr. Chandra, there is no way that I could ever thank you enough for all of your support and all of you who work so diligently at this. This is something that needs to be said. These are things that people need to hear. Suicide and opioid crisis is out of hand here. Let's work as a community. Let's work as a family, and let's change this in our community. Thank you very much.
I don't know how I can carry on right now. Can we take just a few minutes break, and after that we will have panel discussion. Please stay back because these are the experts from all fields who are going to be up here and answering your questions. And again, as Peggy said, awareness is the key. We have for so many years, we have just have a blind eye to this problem. Sometimes we feel like, oh, we know everything. When I started doing this 4 or 5 months, and believe me, I'm a pediatrician myself. My wife is a pediatrician. Even we didn't know the statistics we are talking about. So you can understand how a common person can have the statistics unless it is you, when it is 100% statistics for you. So we don't want you to be statistics. Because I was amazed, last year, Lake County, 1 in 5 7th grader seriously considered attempting suicide. 7th grader. So that means they need to be talked to. They need to away from the screen. We need to ask them, is anybody causing problem to you in the school? Because cyberbullying, school bullying, feeling ourselves inferior, trying to do so many things in school, trying to achieve. There are so many things we have loaded up on our kids. It's amazing. And I'm no psychologist by any means, but I see my kids, how they struggle, they went through the school system, and it is grueling. And they are good. They are no tip over, believe me, they are not. They are all A students throughout and everything. But even I feel, they don't admit that, but I feel that it is too much for them. to achieve that little target they are trying to achieve. I don't know what we all are trying to achieve. Believe me, after 20 years, I'm a doctor. What did the hell I achieve? I don't know. Believe me. And I'm telling you in sincerity, I'm seeing patients day in, day out. Anything different I'm doing? No. And my kids are trying to kill themselves to be a doctor. So we all have to understand that there is a limit to everything. Does not mean we have to achieve. I always say, I want to be a billionaire. Doesn't mean, but I don't want to lose my sleep to become a billionaire. So I think we have to tell our kids that we have to do everything what we can do, but not go after. Don't be crazy about anything. Everything will come. So let's have just 2-minute break. Then I'll get the panelists here, and then we'll ask questions to them, and then we will have a nice vigil. Sheila ji is back there. We have planned a nice vigil for all the loved ones we lost. We have a nice decorating envelope. We have tea lights. We have matching lights and all those kind of things. Because I believe, and I was told, when you do things visually, that's when it has an impact. And that's why we planned it this way. So we listen to all these things. We do the professional panel and do with our hands. When we do our hands, then we know what the importance of this thing is. And that's why the vigil is there, this talk is there, and all of us are here. If the weather was good, we probably have much more people, but we can't fight with nature. Thank you. 2 minutes.
Ready to begin? I'd like to thank everyone who's attending today and who's stayed along to enjoy the questions that we've got. We've got quite a distinguished panel in front of us, and I want to take a moment and thank you all for your participation and taking the time and bearing with us as we're doing our first annual event. It's a learning curve, so thank you all for showing up. We're ready to begin. First question for the panel, I'm going to be directing to Mr. Mark Price, who is from the State Coalition for Human Rights and a board member. Mr. Price, beginning question. I'm asking, how has the epidemic affected families in Lake County as you see it from a judicial standpoint?
So that's a really good question, and I have to first give an apology for Judge Stefaniak. This is better suited for him. However, he's with his fiancée and her family for a death that recently happened. So I'm not as eloquent and I'm not as good looking as the judge, but I'm going to do my best in answering the question. And that having been said, I was the chief deputy for the judicial system here in Lake County, started in the criminal courts, and then went over to the juvenile system. So the best way to answer that question is with an actual very short story. So if you'll give me a little bit of time. We had a young man whose father had started a business with a local car dealership. And basically what they would do is take used cars, detail them, and get them ready for resale. And it was a very lucrative business, and his father had set him up well. However, because of his opioid addiction that nobody was aware of, he had been stealing from the car dealerships, and finally was caught, and it was a really precarious type of situation. The dealership didn't want to press charges, the dad didn't know what to do, and then he came before Judge Stefaniak with a felony. So this is back more in the felony division. It was tough, and since he's not here, I'm going to give you a little bit of insight on the judge. From the outside, he looks like Ming the Merciless. You would think that he is very hard-nosed, but Judge is a very deep and a very emotional man. And so every kind of case that came before us in the felony division, he literally took it to heart. And I remember this one in particular because this young man had the whole world ahead of him, but the opioids just kind of took over his brain. And Judge was trying to do everything he could to give this young man the second chance that he really needed. And he had a couple outstanding warrants out of Markham. The public defender had said that she would go and she'd be on her own time and she would go over there and handle the cases so that Judge could actually go and perform his sentencing. So Judge gave him the time, he postponed sentencing, she went out of state, she took care of his cases in Markham, came back, and it was a very, very lenient sentencing. The father was happy, the mom was happy, this man had another chance at just letting the past go and making the best of it. Well, we know how the story goes. He got caught back up, another couple felonies, he violates, goes to DOC, and and that's it. We thought that when we went to the juvenile division, that now you can make a difference, right? You go from the adults, you come to the juvenile division, and now you can actually start seeing where the problems stem from. And just to be honest, and to end the whole answer to the question, there weren't enough resources. There is such a problem. It's such an epidemic that the system is taxed. It's overwhelmed with the amount of people that need help. And so when you're thinking about how does the justice system handle it, it does it the best it can with what it's got, but it's not enough. And I'm sure law enforcement on the panel will be able to agree as well, but there's your answer.
Thank you very much.
The next question is for you as well, Mark Price. I just want to add to his bio, besides him being a representative and sitting on the board for Safe Coalition for Human Rights, his career on Wall Street after college in 1993 hosted a weekly live television program called Ask an Expert on Channel 26 in Chicago, and currently sit on several boards, schools, business, not-for-profit, including, of course, as I mentioned, Safe Coalition for Human Rights. He is the executive director of the Ileana Search and Rescue Teams that assist first responders in and around the Chicagoland area during emergency situations. The question for you, Mark, would be, why is Safe Village for trafficking victims important to establish here in Indiana?
Another good question. So, like probably most of you out there, I didn't come from this section of life. When I hit the judicial system, that was a whole rude awakening for me. I came from Wall Street, and I was kind of isolated from these things. Didn't have family members involved, and I didn't think it was as big a deal as it is. So why here? Finding out that Lake County is the second largest county in the entire state of Indiana, with over 500,000 people here in our county, and being the crossroads of several major states where trafficking takes place and in drugs, as the sheriff can easily attest to. We are sitting within the hotbed of where all this takes place. And so why Northwest Indiana for a Safe Coalition, for a place where children who are trafficked can go to and get the resources and the care and the professional skills that they need to be taught life skills in general, is because we are at an epicenter of where everything funnels through. I don't know if you knew it or not, but there's over 300,000 individuals under the age of 18 that are trafficked in the United States every year. 300,000. So think about that. Almost the population of our entire county gets trafficked in this country every year under the age of 18. And where we're at, coming from Wisconsin, Iowa, Illinois, Indiana, Ohio, Michigan, 8094 is a huge corridor, I-65. And so when you think of the traffickers, they're using these highways and these arteries that cut right through our county. So why better not to have a facility that is local, centralized, and can offer these services for the children that we're trying to pull out of this mess that they literally consider normal.
Thank you very much. Next questions are being presented. We have someone standing in for Coroner Marilee Fry, Chief Deputy Officer Fife. Is that correct? Thank you. Coroner Fry has served honorably as our Lake County Coroner since September 2012. She has worked tirelessly on efforts and initiatives with Lake County's infant safe sleep, which is SIDS prevention, and heroin epidemic education and prevention. Chief Deputy, 2 questions for you. First is, with the current opioid crisis, can you share what Lake County's current overdose death statistics in recent years look like?
Sure.
Okay.
So, as you heard from Can you hear me? Yes. Okay. So as you heard from the doctor's presentations earlier in the presentation, in Indiana there were 1,840 overdoses in 2017, but that count may be a low count because not all overdoses are reported as such to coroners throughout the state. In Lake County, there were reported 71 drug overdoses in 2013 and 196 in 2017. The opioid epidemic is killing more people that was stated earlier, more than motor vehicle accidents or guns, and is growing faster than an AIDS epidemic at its peak. Our totals are staggering. In 2018, we had a total of 152 overdose deaths. 86 of those were heroin related, 63 of those were fentanyl, 14 of those were methadone, 22 were benzodiazepines, 63 were cocaine. We had 67 homicides in 2018 and a total of 58 suicides. As of this year, we have a total of 48 overdoses. 31 of those are the result of multiple drug intoxication. So it's heroin accompanied with fentanyl, accompanied with cocaine. It's just not an overdose of one. We've had 16 heroin, 19 fentanyl, 2 carfentanil, 8 methadone, benzodiazepines, 11 cocaine. We've had 25 homicides this year. As of 5/15, when this report came out, we had 13 suicides, and as of today, we're up to, and we are at 15 now.
Thank you. Second question. Last year, overdose deaths were down. Can you tell us what that can be attributed to?
As I stated earlier, some of those deaths aren't reported as overdose if they come into the hospital. I was speaking with a lady from Narcan. If Narcan maybe had a hand in the lower overdoses, that we don't know as far as those statistics come. I know that Corner Fried, you talk about awareness and being proactive, and I think ever since she took office, she has been. She has dedicated a part-time employee to do the statistics of all deaths and to report these statistics for Lake County and for the sheriff, for downstate, for the Indiana Department of Health. When we do have overdose deaths of an individual or decedent, those individuals are ran through inspect to see if they were given multiple medications. Our investigators have the hard jobs to go out and deal with families and gather information in reference to their loved ones' deaths. But we also use SAFE, and they provided us with the medication deactivation systems to where our investigators have those in case there are prescription drugs in the house, that they can get rid of them while we are there on scene so that nobody else can have access to those drugs to form an addiction. So Corner Fry, since she has taken office, has been very proactive in the opioid epidemic.
Thank you very much. I'd also like to introduce Dr. Kalyani Gopal, President of the Mid-America Psychological and Counseling Services, President of SAFE CHR. Dr. Gopal is a keynote and international speaker and trainer on foster care and adoption, sex trafficking, child sexual abuse, autism, and neurodevelopmental disorders. Her focus also includes psychopathology, and she's the president-elect of the Illinois Psychological Association. She's received the Indiana Attorney General's Voices for Victims Award and named the United States Congress AMEC Top 20 Global Women of Excellence in 2019. Question from the panel is, what are the warning signs for depression and child suicide? Do they make threats, for example?
Thank you for that question, because it's such an important question to ask, since most people, as Dr. Gold mentioned, really don't know the signs of depression. You think your child is fine, they're in their room, they're playing video games, they're watching TV. You don't really know what they're doing. So when they're very young, and my youngest kid who talked about suicide was 4 years old. Every day in the clinic, I see about 15 to 20 young people and adults. I see all ages. And within a week's time, I must be seeing about 15 young people who are speaking about suicide. Just 3 days ago, I admitted 2 young people into the hospital. One was 15, the other was 8. 8 years old. So what are the signs? How do we know that these children are trying to commit suicide, or even thinking about committing suicide? So these children, when they came in to see me, they came in because they're doing poorly in school. not coming out of their room, trying to avoid conversation, poor eye contact. Some of these kids are very aggressive. That's how they show anger. They show depression through anger. They show anxiety by cutting. Now there's two kinds of suicidal behavior. One is what we call parasuicide, and the other is called suicide, as you all know. The parasuicide is when people cut themselves. So you take a razor and you kind of rub it on, you take the edge of a pencil, the lead pencil, and you keep rubbing it on your arm. Check your children's arms. Check your kid if they have full sleeves all the time in the middle of summer. Why do they have full sleeves on in summer? What are they hiding? Full pants, no shorts. So you're looking for signs. So what are the signs of depression? The very first sign is a remarkable change of behavior. That's what you notice. The same kid you used to know is not the same kid anymore. And right before they try to commit suicide, these children have what we call flight to health. They seem really happy, really cheerful. It's like you get your kid back, as one of the mothers said. That's probably the most dangerous time for these kids. So these mothers, they bring their kids in for suicidal actions or even just sadness. Or they're always blue. So it's not that just blue for 1 or 2 days, but you're blue for a long time. So when we look at it clinically, when I have a kid come in or a young woman come in, 15, 16 years old, a young boy come in. Yesterday I had a young kid come in, he was about 15 years old. And he told me, his mother said, I'm really worried about him. And I said, why? And he says to me, I just feel like I'm drifting. I think I have depersonalization syndrome. So the internet gives you tremendous information, but gives you a lot of wrong information. So when you go in and you tell your mom I have depersonalization syndrome, the mom's going, what the heck is that? So she Googles it, she tries to find out what it is, and scares her. So fortunately, he caught this term. In a way, it is a good thing because the kid was actually going through some parasuicidal behavior. So he was cutting and he was smoking marijuana, and he was also beginning to vape quite a bit. So you all know that these vapes are easily available in schools, and they come like little USB things that you can plug into your laptop. So you're thinking your kid has borrowed a USB from his friend. He's really borrowed a vape. He's borrowed a jewel. Very easily accessible. They come in strawberry, orange. They come in amazing different tastes. So these chemicals, sometimes if they're synthetic, they can precipitate or create a psychotic behavior. They can lead to suicidal actions. So this boy tried to jump out of his car. And I'm kind of changing the history here. I'm combining a few different histories so I don't give you any identifying information. He tried to jump out of his car saying, people are after me, because he became paranoid. And had he succeeded, we would have taken that as suicidal behavior. What he was he's under the influence of drugs. So when you see your child, or you see your neighbor's child, or you see your kids' friends in schools, in colleges, especially kids who've been very protected and they go for the first time away to college, they're not used to the huge world out there. It's terrifying. Kids who are graduating high school, it's terrifying because the world is pretty scary. So what do? They turn to different ways to cope. One of those ways of coping is detaching from people they love. So when you find your kid or your friend's kid or anybody you know, any child that's detaching from the friends they've always had, that is a sign of early depression, suicidal tendencies. So there's 3 parts of suicide. One is there a plan? Or is there an ideation, what we call suicidal ideation? It means, do you think about suicide? So when I talk to a kid, I'll say, as a parent, you can ask your child, well, how do you feel about where your life is going? Are you hopeful? Are you not hopeful? Do you feel like there's no future? So you're looking at the child's sense of hope. So we call it the depressive triad, right? It's a sense of hopelessness, helplessness, and a detachment from the world. Those are 3 aspects that lead to suicidal behavior.
Thank you, Dr. Gopal.
And next I'd like to introduce Dr. Neetha Fiona Nagubadi. She has over 15 years of commercial and education sector training, consulting and project management, and business process improvement experience. She has a doctorate in business psychology, MS in computer science, and BA in psychology from the University of Chicago. She has developed programs to support with youth affected by drug addiction and to provide a sense of community, especially among bicultural youth, and suicide prevention. I actually have 2 questions for you. What are ways we could intervene or support young adults in the community who are struggling with either suicide or drug addiction or both?
Thank you. So I also wanted to add that I also lost my brother to Vinod. His name is Vinod Nagubadi, and on May 13th, it would have been 14 years since he passed away of accidental overdose of Vicodin, prescription medicine. So we have an organization in his name called Each Life is Precious. We have a website. I want to just share a funny thing. This week, his website was down on Monday. So I know about technology. And it was down, and I put in a ticket to the host company, what's happening. And this is the host that actually Vinod and I selected for some other website. And that day, it also started to redirect on its own to another site called youcan'tbeerased.com, which I've never visited. I didn't even know what that site was. I had a feeling he had something to do with that. If any of you know anything about websites, it's hard enough to do that physically, to just have a site redirect. So I think he was letting us know, that this effort, what Dr. Chandra and everybody here on the team, Dr. Vijay, who we worked with before, are doing this to create more awareness and sharing the stories. It was a very powerful sign. That site was about depression and suicide. A youth that I encourage if you can visit that site, because that must be a reason I saw it on Monday. And the student is sharing he survived himself from attempts, and how he's sharing his story to help empower others, like those who are sharing today. And going to your question, sorry I had to mention this since it was so powerful. Going to the question, I view this, I specifically choose to use organizational psychology because I like to come up with solutions. So there's a lot of emotion involved with this, but I like to use the solutions that are working for other organizations and bring together the ecosystem. So we all are, strong subject matter experts. Let's bring this together in a community and also take ownership. I think each of us, I view this as an analogy of rowing in a boat. So in a family, we're in a boat together. How are we, assisting others when maybe there's a hole in their section of the boat? We all either take ownership of it along the way as we're assisting or afterwards. So I think the skills development and cultural sensitivity is an area that I like to focus on, because sometimes knowing the solution for that individual's family and person is very important. Not one solution doesn't fit all. So in our case, Indian American household, it's very different. The identity of family structure is different. So we like to focus on diversity because we want to educate people. There are different ways of doing things, and so not to make assumptions. You can do more harm. So I think those are some of the areas that I wanted to make sure to touch upon too. That's interconnected.
Thank you. And this other question, because you are also dealing with drug addiction in the youth, families would like to know what is out there for them to know how to help the addict.
Yeah, so there are many resources I think people have mentioned of what's out there to help them. So you can also ask the doctors here too to advise on what are the support groups, but also I went to a couple of Al-Anon meetings myself too. Those are also supportive because it allows the family members to know what can we do. So I go back to this ownership of the skills. As an older sister, I had to do that myself too, and that's what we can do. So we either do that. I'd like to do that before anything happens too. So these are powerful resources. And also, if there's not in a place that you go to, such as a temple or a community center like this, I would ask where's the place that people can just spend time together, to celebrate success for the youth, but also to talk about when there are problems too. Those should be a normal thing, that we all have good days and bad days, so to have a system for that. So I'm trying to improve that in areas that I'm involved with, at the temple, etc., where I think we can do more for providing a sense of community when things are, not going well also, too. Yeah,
Thank you. And the next is the representative from Porter Stark Services. Not sure if Todd Willis is here.
He's right next to
you're
you.
right here. I'm sorry. I didn't see your sign. Todd S. Willis, of course, is the Director of Prevention and Education at Porter Stark Services. He is certified in suicide and drug addiction as a counselor. The question for you, Mr. Willis: how can families prevent child and adolescent suicide? And tell us about the statistics in Lake County.
Sorry to get in your personal space, Doctor. Thanks again for just being here, and the stories and personal accounts from the families are still kind of weighing on me a bit. But I think, we have a very distinguished panel up here and lots of experience, but what can families do to kind of prevent suicide? You heard it already today. Belongingness and feeling like they belong somewhere is vital. Feeling connected. The other thing we see, some of the statistics you heard, maybe one you didn't, by 2020, the #1 health problem that's going to be in America is depression. Health problem. And so belongingness and helping people to communicate and have open dialogue with one another is incredibly vital. People that come into Porter Stark for either anxiety or depression talk about sometimes a lack of purpose. Finding that purpose in your life, whether that's through people or the things that you value, also is very important for helping families talk to their kids about.
One more question, if I may, because this is so prevalent to our college students and also high school students, is what can we do? I see that there's an increase in suicide prevention. Well, we want to prevent it, but in college, I've experienced that with my daughter and her neighbors.
Right.
In the dorm.
I teach on a couple different college campuses, and that's an area that we are not attacking very well. We're tied into, I'm a clinician that's worked with kids. Everybody wants to focus on kids, obviously. But the college campuses were overwhelmed. Some of the campuses that have counseling centers, they don't have enough appointment times for folks. And so it's a real issue. Again, awareness is part of the problem, but stigma is also an issue. College students feeling that they can talk about these things, not just with their families, but on a campus. So really attacking that stigma. The other thing is that we're trying to do on some of our campuses is equip college students with tools so they can help one another. Mental health first aid, I know there's some places in Lake County that's doing that, Porter County's doing that, and the whole part of that training is to give people the tools of what to say when your roommate is depressed or you need to check in on them, how to ask those questions. And so if out in the community, if you're interested in that training, there's a lot of centers around here that are doing it, and some free of charge. Look into it. It's mental health first aid, and it's how to help people through that crisis of depression or addiction.
Thank you. And I'd like to introduce next our Sheriff Oscar Martinez. He's the Lake County Sheriff. As a veteran of the Lake County Sheriff's Department for over 24 years, he is a lifelong resident of Lake County, Indiana, born in Gary and raised in East Chicago. On becoming sheriff, his goals were to tackle narcotics trafficking and abuse in the area by rebuilding the department's highway interdiction team. Before the unit was dismantled, his name made headlines with large busts, seizing millions of dollars and drugs. And the question for you, Sheriff, is what is the Lake County Sheriff's Department doing to address the opioid crisis here in Lake County?
Thank you. It's a pleasure being here, and I want to thank the Indian Medical Association for hosting this event, and all the elected officials, chiefs of police, counselors, doctors that are here. I think this is a great turnout and look forward to participating in next year's event. When I became sheriff, we see so many organizations and clinics and doctors getting involved to deal with opioid problem. And we were also involved with trying to help individuals before they get into our jail. But I also realized that I have a population of about 850 inmates in our jail. They're already in our jail. And when we get individuals coming into our jail with an alcohol problem or addiction or an opioid problem, why not take advantage of that situation and try to help them? Instead of putting them in a cell in a drunk tank and just let them sober up. Well, they start going through withdrawals, they get sick. So I looked at it, it was the best opportunity to take action and help them recover. So what I did was start it's a Vivitrol program. Now it doesn't work for everyone, but I kind of wanted to go that route with Vivitrol, unlike Suboxone or Methadone, where you build a dependency for that that's also abused. We see it sold out on the street as well. So what we started was that every inmate that comes into our jail, they get medically evaluated. And if they have an addiction either with alcohol or narcotics or an opioid addiction, what we do, they're evaluated by medical. They're also evaluated by our mental health. Now what we have in our jail, we have a medical staff, we have mental health doctors, we have several qualified mental health professionals. They're called our QMHPs. We have psychiatric nurse practitioners. We have a very impressive mental health and clinical division in our jail. So we took advantage of that. And so as they come in, I partner up with the judges as well. Wanted to make it as an alternative to prosecution. We can't force them to be medicated or anything like that, or to participate in this program. But if you're given an option, either prosecution or volunteer for this program, it works out. But they all have to be evaluated. It's called, our mental health evaluates the inmate. The most important thing is called Eureka, but the first thing that they do is, do they want to help themselves? You know, they got to be willing to want to change and help themselves. And also the Vivitrol does affect the liver as well, so there's medical examinations as well that if they're a good candidate for this program. So once they go through our medical division and they go through detox, they go through our mental health division as well. And we start working with probation and our reentry program. And what happens is that individuals given the shot of Vivitrol, and that shot costs about $1,800, and I managed to get that shot for free, the first dosage in our jail. And what that does, it blocks the opioid receptors in your brain, so you don't get that euphoria or that crave to want to use heroin or an opioid. And it lasts for 28 days, but it takes more than just that. Our reentry program helps them with other social workers when they leave, belong to an organization or a church, because it takes more than just that shot. And we've been very successful with that, with the addiction part inside our jail, because we all know those that are addicted will steal from their own family, they will shoplift, they're going to end up in our jail. And that's the best opportunity for us, at least while they're in our jail, to try to make a difference. We have a mental health division that we deal with mental health and suicides. We're starting a new division for behavior management as well. We're separating those inmates. Instead of them being all together in a group, we're pulling those inmates away from the general population that suffer from mental health, and we're making sure that they seek help, therapeutic treatment or medication, social workers. We have counselors that come in, church groups. So that's very important. Now, it's quite fascinating what we do in our department, and that is dealing with addiction. We deal with mental health. We deal with recovery. We deal with enforcement. We have officers that go out there and go after drug traffickers that are trafficking narcotics through our highways. They hide them in hidden compartments, tires, gas tanks. And our officers are out there to intercept, and they're highly trained to intercept those drug traffickers bringing this poison into our community. After that, we have our officers that are get training, awareness, and we have a heroin overdose response team. So we've taken it a step further, along with other agencies, where if there is an overdose, that team responds to the scene and recover enough evidence there, including their cell phones and everything, to go after the person who sold that drugs, to prosecute that person that sold the drugs. They're responsible for that overdose. And we are going after those drug dealers that sold that poison to the loved ones. They're all equipped with Narcan. I think a lot of departments are equipped now with Narcan. So if we respond to an overdose, we give the dose of Narcan to reverse the effect. We also have a training for individual civilians in the use of Narcan, because usually the very first responders are the family that find their loved one overdose. So we're starting training on the use of Narcan for regular civilians as well. So it's a multifaceted, organization that I belong to. The men and women of law enforcement that go after the drug traffickers, the men and women that help in our jail and the recovery process, and it's our part that we do as far as law enforcement and undercover work, going after, just like in any profession. I know there's a lot of doctors here, but just like in any profession, there are bad apples, some bad apples. And we are going after doctors that are overprescribing. The pharmaceutical business is a multi-billion-dollar business, and I think we've seen where some are overprescribing and making money off on the side. So we do have investigators in the diversion program that investigate those type of incidents. So we're covering every end, but it's a partnership as well. It's not just the Lake County Sheriff's Department, it's a partnership with the judges, with the coroners, with other agencies like Lake Station. It's working together to address this problem.
Thank you.
I'd like to welcome and introduce Chief David Johnson. He is the Lake Station Police Chief. Chief Johnson is an Iraq veteran and member of the Lake Station Police Department for more than 12 years. He started out as a patrolman and moved up to patrol supervision as a corporal before becoming the school's resource officer for more than 3 years. He was in the Detective Bureau for 2.5 years before his promotion. You see that? His promotion to chief. He stresses that relationships in making things happen, whether you're working with parents or a student or more serious situations. I have 2 questions for you, Chief Johnson. First is, what is the one thing that you would like to see happen to increase the effectiveness for law enforcement in relation to child suicide or opioid use?
Just as was mentioned in my introduction, it boils down to relationship, whether it be a relationship within the community or having a relationship, having officers in our schools. It was heartbreaking to listen to all the different stories, and we heard different age ranges. And we all know that drugs and alcohol and all those things, our children are exposed to those things at a very young age. As Mr. Price had mentioned, tackling the problems before they become adult issues. I truly believe in that. That said, there's a lot of children out there that they're living in a repeat cycle, so to speak. The families they're being raised in, it's a repeat cycle. Their parents are addicted to alcohol or drugs, and then that's the life that they know. And somebody's got to be there to be a part of breaking that cycle for them. And I think it starts at a very young age, whether that be law enforcement, counselors in the schools, teachers in the schools. As many people have mentioned, the sheriff mentioned partnerships, relationships, partnerships, whether it be law enforcement, teachers, the courts, the doctors. Ultimately, that's why we're all here right now.
Thank you. Second question, how can citizens support your effort? How can citizens support that effort?
It all starts right here. Thankful that Dr. Chandra invited me here, and he's bringing a lot of exposure to that. And this is where it starts, conversations like this, and continue on with the conversation. Don't let it end here. I hope to see this event grow, and I hope to see others learn from this. I didn't know what to expect coming into this, but I definitely have learned some things, and that's where it starts the conversation.
Thank you, Chief Johnson. I'd like to introduce Dr. William Watkins. He began as an assistant professor of criminal justice at IUN in the fall of 2017. Dr. Watkins has been teaching in higher education for over 10 years. His teaching and research have a primary focus on substance use and abuse, as well as drug policy at the local and national levels. He has published in peer-reviewed journals and presented at national conferences. His research on prescription drug abuse, misuse, examining risk factors, consequences, and responses to this behavior. I have 2 questions. First is, what is lacking in the current efforts to educate the public on this deadly problem?
I believe that currently we are focusing more as far as educational efforts about the risk factors and the dangers of opioid abuse and addiction, more so on the adult demographic versus children. And obviously that ties into this panel specifically. As an adult, you can pick up a pamphlet, you can seek counseling, you can almost have the dangers of opioid abuse and the possible warning signs for it almost thrown in your face. But from the 18 and under crowd, it's not as available. And we know, just given the nature of adolescence, risk-seeking behavior, things of that nature, that you are going to have between roughly the 12 and 17-year-old age demographic is going to be at a heightened risk for experimenting, for taking on risky behaviors, etc. And we currently see more efforts placed toward the adult population as far as stay away from these drugs. If you are addicted to these drugs, here are the resources available to you, and not necessarily ignoring, but not putting as much attention to adolescents and even to a certain extent young adults, where the heightened risk for addiction, misuse, overdosing, etc. Would most likely be. If I may give a personal example of how we're a little bit less cautious about this that I'm comfortable with, back when I was in high school, my senior year, I had to get my wisdom teeth pulled, actually, only 2 of them. Upon making the appointment, I got a prescription for 30 Vicodin. Why I needed 30 Vicodin, I have no clue. Came back 1 week later, got 2 teeth extracted, got a prescription for 30 Oxycontin. 60 pills for 2 teeth. Wow. And even I, at that age, was like, this is not right. Something's amiss about this. I literally, out of that entire 60 pill cache, used 1. And so that was me at 18. And while I know that we have cracked down more on prescription drug monitoring, while we have cracked down on whether it's dentists, surgeons, just your everyday general practitioners for how they write prescriptions, this still goes on very easily. And so I believe that getting to that younger demographic, to the 18-year-old who, unlike me, might not say, oh, something's not right about this, I should not have 30 of these pills at my disposal, versus the kid who goes, all right, this weekend's gonna be a party. Or again, or you're talking about the trafficking, so now we're going into the law enforcement aspect of it. But again, we're not really reaching out to that population as much as I think that we should, given the multiple risk factors that could that are within that demographic and the heightened risk that exists within that population.
So if zoning in on educating the public, how can we address the shortfalls in that?
How can we address the shortfalls? Essentially, we need to educate the public, and again, I'm going to focus more on the youth here, about the dangers of opioids, prescription drug misuse, and much of my research also delves into the misuse of prescription stimulants, namely ADHD medication, your Ritalin, your Dexedrine, your Adderall, etc. Since roughly the mid-1990s, we have seen prescriptions of these drugs go up almost 500%. It is one of the most trafficked drugs on college campuses, illicitly. And we're seeing much more prescriptions for individuals even as young as, I believe last I saw, the youngest prescription that was written for someone with ADHD was about 4 years old. I don't know if anyone here has a 4-year-old, but they bounce off the walls. That's what 4-year-olds do. So for saying, oh, this child has ADHD and giving them prescriptions, starting them off very young, let alone in high school, let alone in college. Where I went to college, the University of Michigan, it was widely known that if you went to the library around finals time, you throw a rock and it bounces off 2 people who would be willing to either give you or sell you very cheaply Adderall, Ritalin, Dexedrine, etc. And many people, again, just kind of took this on as a normality. And I think that when it comes to educating the public about the dangers, we currently, as a nation, spend more educating the public about the dangers of marijuana use. And even as a state of Indiana, I live in Chicago, state of Illinois does the same thing. We spend more money on prevention of marijuana use, a drug that, without getting on a tangent, is legalized in certain states, is medicalized in many states, and is decriminalized in many states or municipalities, than we do nationally on opioid education and prevention. I think that is primarily a pivot that we need to make, not necessarily away from trying to keep kids off of pot, if you will, but that we need to put more resources, more effort, and more attention on what are the more dangerous and risky substances, which obviously would include opioids and anything in that family.
Thank you, Dr. Watkins.
The next I'd like to, I hope you guys are taking notes. This is very vital information that many of you that are here, parents, please take note. This could be your child and not know it. Next is Mr. Dan Peck, CEO, Swanson Center is in Indiana. The Swanson Center is an Indiana licensed clinical social worker by training. Mr. Peck has extensive regional experience as both a clinical expert and leader of community mental health executive. Swanson Center provides the full continuum of mental and behavioral health services to LaPorte County residents. The question for you, Mr. Peck, is what are the various residential treatments that are available to treat opioid users?
Well, that's actually a very good question. Fortunately, as we started this evening hearing from several of our legislators, a number of them talked about recent bills that have been brought forth both at the state level as well as the national level to address the issue of opioid treatment. And so, fortunately, there's always good that comes up bad. And with the opioid crisis, it has raised awareness that this really is an issue and treatment is necessary. And it's not easy treatment. You can provide talk therapy, you can provide medication-assisted treatment therapies, but when you do it on an outpatient basis, it occurs in an office, and then the person leaves and goes back to an environment which is full of temptation, full of influences. Your friends, your buddies, your acquaintances are using, and relapse is very, very possible. One way of trying to do that is to create an alternative environment which allows the person to focus on recovery. That's what residential treatment does for the work of addictions. And fortunately, and I want to thank the legislators who are here for bringing forth those bills and passing them to increase the number of residential treatment facilities in our region as well as across the state. There are a number of very good residential treatments in Lake County, in Porter County, and hopefully in the future, LaPorte County. So within the northwestern corridor, there will be more treatment available. One of the things that we did in LaPorte County, because we don't have a residential treatment, was that we partnered with the Healthcare Foundation of LaPorte to use grant dollars to eliminate the barriers towards treatment. For individuals to get into either an inpatient detox program or a residential detox program, there were 3 primary barriers for LaPorte County residents. The first is cost. This time last year, Medicaid didn't cover the cost of residential treatment or inpatient treatment for addiction. And individuals were faced with up to $1,000 a day for out-of-home treatment for addiction. I can't afford $1,000 a day treatment. It'd be hard-pressed for anyone in the room to be able to do that for 28 days, 30 days. So cost was one barrier. The second barrier was access. We have a number of treatment facilities within the region, but many of which would have up to 8 weeks wait list to get in. When somebody is using an opioid, and perhaps it's laced with fentanyl, they don't have 8 weeks. And so, in talking with some of the providers, they actually did have beds that were available. The problem was that individuals didn't have a payer for those beds, and so they only reserved certain beds for those with private pay. And so those beds were what were taking 8 weeks to get into. So in addition to cost, it was access. The third issue was transportation, especially for LaPorte County residents. If that meant coming over to Lake County to access one of those beds, if they could afford it and if they could find one, they had no way of getting here. And so Swanson Center approached the Healthcare Foundation of LaPorte to establish what we have named Detox Now, which is a grant program that eliminates those 3 barriers. So if someone wants to get into treatment, the grant would pay for them entirely out of pocket, no cost to the individual. We had relationships, and we remain to have those relationships with a number of different treatment facilities in the region that would be able to get access for us for those beds that were being held for those that were private pay. We could access right away. And then the grant would also pay for transportation to get individuals into those facilities. The longest we waited for an individual, if they wanted the treatment, was no more than 2.5 hours. Through the Detox Now grant, we helped over 70 individuals access treatment at no cost to themselves. And that's a small start. But I really do want to thank the legislators in the room for advancing Medicaid coverage for treatment, and to bring forth the dollars to increase the number of facilities so people don't have to wait 8 weeks to get in.
Thank you very much. I'd like to introduce Dr. Nikhil Shetty. He's a specialist in interventional pain and spine medicine. He sees patients in Munster and at St. Mary's Hospital. He's also a partner at Midwest Interventional Spine Specialist for the previous 2 years. Question for you, Dr. Shetty. How is the medical community offering assistance to patients that have pain issues in lieu of opioid prescriptions?
Thank you for that question. And thank you very much to everybody in attendance, Dr. Chandra especially for putting this on. Also, I'd like to thank the family members and loved ones for sharing the stories of Dosh, Nolan, and Jack. And they were very touching. And thank you for opening yourself up for that. And it's really inspiring and emotional. And thank you very much for doing that this evening. And thank you all for gathering here and showing your interest in being passionate about this cause. It's a very important cause, and it's a very important issue that's affecting all of us. I think panels like this are important, and like a few of us have mentioned, communication is very important. Getting together and developing those relationships that we talked about is very important in combating this problem that's affecting all of us. And going back to your question, as an interventional pain specialist, the conversations that I have with many of the people that may be in this room or are part of this community is it starts with setting up our goals and what are our expectations. As a pain specialist, my number one goal, and the reason I chose to do this job, is to help relieve the pain and suffering of my patients. Nothing would make me happier than being able to relieve the pain and suffering of my patients. And as we've seen and as time has gone, the methods with which practitioners were doing that have changed. And my number two goal right behind that is to reduce the use of opiate medications. And that's by and large amongst all my patients. So how do I achieve that goal of reducing somebody's pain while also reducing the overuse of opiate pain medications is through the use of technology and innovation that's really been developed over the past 20, 25 years in the field of interventional pain and spine medicine. Nowadays, there are many different ways to take care of somebody's pain without having to rely on a tablet or without having to rely on a pain medication to alleviate their suffering. And we do this comprehensively. Interventional pain specialists all across the board have developed algorithms to treat people on an individual basis, whether it's through the use of physical and occupational therapy, topical analgesia, epidural steroid injections, for example, joint injections, radiofrequency ablations. There are many different modalities that we have before we rely on somebody to put them on a chronic opiate medication. As a pain specialist, we're not trying to demonize the use of opiate medications, but more importantly, it's to limit the overuse and overprescription of these opiate pain medications that have provided this opportunistic individuals to abuse these medications. And I take that as my personal responsibility, number one, to relieve people's pain. That's why I chose to do what I do. That's why I enjoy my job so much. And number two, to reduce the use of opiate pain medications, and I do that with various different modalities and treatment techniques that I've been able to, like I said, we stand on the shoulders of giants, my teachers before me, and the partners that I work with, and I'm fortunate to work with in this area, to learn these various techniques to how we can treat people's pain without having to rely on these harmful, potentially harmful opiate and addicting pain medications.
Thank you, Dr. Shetty.
That's all very good questions, but if I may, I'm going to take the liberty to ask one last question for the parents. And the doctors know that number one, child suicide is due to bullying. Can you agree with me? As parents in the schools, anyone in the panel would like to answer this question. Do you get involved when a patient comes to you or to juvenile comes to you because of being bullied? Do you intervene? Do you do anything to intervene and deal with the schools at all? Just want to know this for my personal use and all the children that I can advocate for.
Absolutely, and I'll take that question because we work with the schools so closely. Frequently, children who are bullied will say that they were told to kill themselves. Facebook, Instagram, Snapchat, go kill yourself. So these children then come in and they're terrified, they're scared, and the parents come in angry and upset because nothing's happening. It's not that nothing's happening in the schools are overwhelmed. They're understaffed and overwhelmed. So what happens is when the parents come in and they discuss this issue with us, we actually do what's called an IEP, which is an individualized education plan, so that to get the kid back on track. So actually every parent, by the way, has 30 days by state law. If your child is failing in school, if your child is being abused, if your child is being treated unfairly or has some other academic or social issues that are challenging, you can ask for an IEP. And then within 30 days, the school is required to provide you one. And then you can ask for the child's therapist to be part of that.
Thank you so much. Thank you to all the panel that's been. Actually, I need to introduce someone here. He can't introduce himself, although the script is right here so he can introduce himself. And I said, no, I'm not going to let him do that. I want to welcome you, and I thank him for coming on the radio. He has such a passion for this. You just have, I don't know if he even got to sleep last night, but his name is Swadesh Chandra, Dr. Chandra. He is the president of Indian Medical Association. Can we give him a loud round of applause tonight?
Thank you so much. Thank you. I would like to thank each and every one of you, because this is why this is important. Because there's never been an instance where these many people with a different variety of experts has been on the panel and answering questions at the same time. I was not able to listen to all of it, but believe me, whatever I listened, it made all the sense. And that's what they say, if we all connect together, I think we can deal with this. I sincerely believe, because we are working in pieces, like we have to come like a mosaic together. You know what I mean? We are working in pieces together. We are not together. That's the problem. We don't communicate with each other. So if we communicate with each other, we are trying to do things separately. But if we communicate with each other, believe me, no problem is solved. That's what I believe. Because persistence pays. But thank you so much for being here. I cannot thank you guys enough. And we have to, this is from Geminis, from Indiana Suicide Prevention Network. On August 2nd, there is a pre-conference for suicide prevention. Please make sure that you guys attend that. Because unless these resources come out, we are never going to know what we need to do. Okay? And I just have to thank everybody, especially the volunteers who made this possible, because without them, it is absolutely not possible. So thank you so much. I cannot name everybody because there were almost 150 people who came for almost all the meetings. So it was great. And first of all, I have to congratulate for all of you guys who've been here despite the crummy weather we had. I think we have to give a round of applause for you guys who made, despite the fact it was terrible outside. Thank you, thank you, thank you so much.
So if anybody needs a bag, please raise your hand. We have over 200 of these bags, and please do not turn on the lights. I will tell you how to turn them on. So as Dr. Chandra said, you know, when you have a candlelight vigil, I'm hoping this will seal within you something visual. I mean, you've guys seen the booths, you've heard the speakers, and hopefully this will stay with you forever. So the point of this ceremony, it's an opportunity to remember all those we have lost. It is a chance to celebrate their lives. So tonight, let us celebrate and honor the lives of not only those who have survived addiction or suicide, but also those who are no longer with us. Drugs, as you've seen, show no preference. It strikes children, adults, family, co-workers, and friends. So tonight, let us pay a tribute to those we love and all those whose lives have been touched by suicide and drugs. And I don't know how many of you guys saw the remembrance tree that's outside. It was overwhelming. Over 50 ribbons were up of those whose names are on there, the people that have been touched by suicide and opioid overdose. So obviously this is not just a simple problem, right? It affects every one of us. So if I could have, we're going to learn today what ASHA stands for. Everybody knows what it stands for, hope. And we're also going to learn what each of those letters stand for. And our volunteers who are, you know, teens, tweens, because they are the ones who are at the front side, right? Because this is child suicide. So before we do that, I want to have Mrs. Easton, as we've heard some of their personal stories earlier today. So just very briefly, Peggy, if you could say if there was one thing that you wish you had known to have helped your son.
I liked the part that you spoke of, Deputy, about the Vivitrol. I believe that was the name of that drug. I think had I known about that, that may have been something that could have helped him.
And so, with that, we're going to light the first letter, A. Dalen, if you could tell us what it stands for.
Awareness.
Did you guys hear that? A is for?
Awareness.
Dr. Gold, same question.
Thinking back, I wish I knew that Nolan was still in pain. I thought he had enough help and that he was doing well enough, but I just wish I knew he was still in such great pain.
And the next letter, if we could tell Sam, what does S stand for?
Support.
Support. That's something, you know, I hope you guys gained, that, you know, it's not just a one-person problem. There's many people here that are here to support. And that's important. There's a lot of loneliness. And next, H, Nikki? Help. And that goes with support, right? Help. There's a lot of resources, so many booths that we're here today. And hopefully we're here for this. Action. And you're not just coming here, just to listen. Hopefully the next step, it might be slow, but it'll happen, is to take action. And if I could have Mr. and Mrs. Uni say how we're going to turn on the lights. So the lights will go on if this applies to you.
I am Mrs. Suni, Santosh's mom. Now I would like everybody to turn on these lights to celebrate the lives of the one who lost their lives to suicide.
I would like for you to turn on the lights if you are here to support those who have lost their lives to addiction. Next, I would like you to turn on the lights if you are here to support those and take steps towards awareness. Next, turn on the lights if you are here to support and talk to your children about that they're not lonely. Please turn on your lights and keep them on. And I'm hoping each and every one has been lit. So we will hold a 30 seconds, a moment of silence. Think of those that we have lost and those that we are here to help. Thank you for that. Remember, our path to the future is one of hope. Someday we won't have to be afraid. Someday we don't have to worry about suicide and addiction. And events such as these are the first step in acknowledgement that you will take towards a solution. So these bags are for you to keep, okay? And remember why you came here by looking at those. Thank you.